All right, so David is came up today and he's tell me he got this pain between the shoulder blades. Can you point it out? Turn around and point it out.
Right around here.
What about right in here?
Yes.
And can you describe that pain?
When I bring my arm back, I can't go too far back to the right without feeling that it kind of pinches somewhere in here.
Okay. So what's happened? Sometimes people come in and they think it's between the shoulder blades, and of course people start digging there with elbows, try to work around, but as they know that pain ligaments and referral pain, they might be know this is sometimes it's come from the cervical area. And what we're going to do, we're going to test, of course, the shoulder, the neck, and see what's going on, the problem up here, maybe some compensation. But definitely, I'm not going to jump on those rhomboids and try to stretch them because I think that's the problem. I'm going to work all around. So let's do that. Let me drop this book off, and I'm gonna start testing the neck. To test the neck, go ahead, put your feet together, stand up. I think you step like
This way?
Put your feet together.
Together.
Yeah, come on, always feet together. When you're testing, your feet together. So what I want to see how his neck is turning. I want him to turn to the left, and I'm looking for like around 80 degrees. Correct. You see, he knows, but he's let me see if I can help you. Yeah, you see he's kind of, so he got 45. Something's stuck in the neck. Let's turn to the right. Right is much better, right? You can tell. So the right is much better. See, he can turn without any problem with the compensation, but when he turned to the left, it's some pain and he's so limited. Can you go look it up as much as possible? He's a little bit short on the extension of the spine, so his cervical can extend. Can you flex? And he can flex. So usually this is like already giving us the suspect something going on where, turn for the camera, it's in here. It could be a C7, T1, and that pain also can be referral from that C3, from the nerve from your neck. Now, what I'm looking for that postural. Look at that shoulder, how that shoulder is high. You see that shoulder? He shrugged that shoulder. You can see it. You can see it on this camera. Yeah, you turn back, but look at that shoulder. He's like this. He's shrugging that shoulder. He also can be push on that brachial plexus nerve, and that could be the problem. So what we're going to do, let's see that shoulder mobility. Go ahead and squeeze your thumb together and try to reach behind you.
Right, so here's
Yeah, look at that distance. Go switch. And oh, look at that. You see how when he's doing that, his head is coming on the side. So he do compensation. He can reach behind his head. When he's trying to reach behind his head, he have to lean forward to reach behind. So that means something going on. It's thoracic mobility, shoulder and neck together. If you're just gonna treat that area, it's my help for a couple hours or maybe a day or two. But then if he come back, he's gonna do the same problem over and over and over again. What we're going to do, we're going to work on David, and we start with the neck. So go ahead, lay down.
Face up.
Face up. You can.
Okay.
Yeah, you can.
Okay.
You can take. Okay, so David is on the table, and remember, I'm start working on not exactly on that spot. And people who first time meet me, they usually like, oh, why you don't work on that painful spot? Because I know the problem is not there. But of course, I usually start with a painful spot for 5-10 minutes. But in an educational purpose, I'm just telling you, start with a painful spot, even if you know its problem is not there. But what we're doing here, we want to check that neck again. So we want to get this. Check the flexion and rotation. We bring this in the flexion. We're checking rotation of the neck right now. Ask him to turn around. And it's, how's it feel? Good?
Yeah, feels okay.
Now turn to the left. And that's a limited. So it's stuck. You probably see on the camera right here. We're going to add more. But this is stuck. And I'm trying to help him. Let's see if I can go a little bit even further, and I'm stuck up here. So we got this problem on the left side. Now let's check and I can feel it. You feel that? I'm already feel that bump on the left side of his Yeah, C3, C4 is right in here. It could be sensitive too. I always check that laminum groove and see if anything push me to the side, my finger, and start working. Okay, so next test is going to be we're going to do a rotation and try to tuck your chin. And it's not going. So I don't want to even do this because it looks like it's painful for him. To the right and tuck your chin. And this one is a little bit better, but it's still stuck too. So it could be a OA joint. It could be the lower portion of the neck with the stiffness, that douch hump, when that head is shifted forward. Could be that problem too. But what I'm going to do, I'm just going to work on that neck and see if I can improve. I'm going to work on that neck and that left shoulder and see if I can improve this rotation and at least eliminate that pain, which is possible. And the first thing always start with decompression. I grab the neck, coming right in here. You can see my big thumb, it's get close to the neck. I'm not trying to choke the person. I'm just grab it, and all I do, I'm just pull him with my body. Pull, I can pull, hold, I can do some movements. I do not add side bending. I see a lot of people start do side bending. We don't want to do the side bending. I don't know where this come from. If you see the neck, how the neck designed, those vertebrae, you don't want to do side bend. Maybe slight one, but not like crazy. I see people doing this big stretch. No, you don't want that. Okay, so, and you can do this many times till the client is relaxed. I'm also wanting him to relax and breathe. Exactly. Now he started let it go. And look at this shoulder, how high this shoulder is from the floor. It's because he's like this, especially that one. And look at this. This shoulder is bigger than this one. This is more skinnier. Yeah, so you always pay attention to this. My nose is itching. Here we go. Now I want to work on that laminum. I'm rotate this to that whatever he can go. He's not go a lot. And all I do, I'm gently glide my finger down that laminum groove in the cervical area. And if I feel there's something pushing me or something like not right, I'll always ask questions. Are you doing okay? Is now no pain?
No, it feels good.
Exactly. With neck, we always work gently. We don't do all those crazy movements. And my speed is a little bit faster. I go very slow. This is double speed up because you guys don't want to watch that slow more work. But for the real practice, you need to go super slow. And next one, I'm apply that finger to lamina, and I do just kind of lean back. So if one of that vertebra is pops, it's gonna pop back. Do I use a lot of force? No, I don't want to do any. How does it feel?
It feels good.
It feels good. So you see what I did? I rotated to the left and kind of bring a little bit here, and I start using that. So rotation, slight side bending. And I just move up and down. So that finger is coming that way. Good. I'm gonna start switch to the right. Here we go. Very gently. I want to work both sides, For the video purpose, I can just show you the right one and it should be good, but I want to truly help him and make sure that neck is going to turn. How's it feel?
It's very relaxing.
Good. Here we go. Pressure is okay?
Yeah.
Exactly. So always ask. Sometimes people get this inflammation in the neck and it's very sensitive to touch. I have this 75 years old lady, and it took me like 10 minutes to just at least start touching because he got so inflamed. It's took me 10 minutes to make sure she's relaxed because she was in pain. So again, side bending, move. There we go. Nothing click yet, but that's fine. Some people looking for this click adjustment. No, it's not necessary. Here we go. Next one, remember, he can turn to the left a lot. So I want him to take this first barrier. So he's right here. I'm applying slight pressure to the left. Now you're gonna open your eyes and you start to look left and right. So all he do, he's try to look left and go. Guess what? When I'm start holding him, his jaw is moving too. He can feel it. I'm kind of hold the jaw too. Only his eyes is looking left and right, left and right, left and right. And now go ahead, look to the left, always to the left, and I try to turn a little bit more. Pain? No?
No.
Good. So what he's doing, we add our deep six muscles in our eyes. Sometimes they stuck, and the person wasn't look much to this left side because the eye muscle was tight. And guess what? It's also jammed the neck. So always check those eyes. And I'm go back to massaging again that back muscle, splenius capitis, also this posterior scallions muscles, mid scallions, very gently and nice. Yeah, people say, oh, it's a triangle, it's a nerves up there, an artery. Yeah, just be gentle. And if you grab something you feel pulsation, or clients get this negative feedbacks, just stop doing that. Very gently. That's why I'm not rush myself. And I'm not doing this. And yeah, I see people doing that. On the championship for massage therapy, the guy doing this. And I'm like, why? Why are you doing this? It's a neck. Okay, sternocleidomastoid is an important muscle. You bend to the side, which is you working on. So I'm working on the right side. I want to bend to the right side, and I start squeeze that muscle up. David today is get a lot of massages. What a day, David, huh? Yeah.
That's good.
So I scoop it up and release. And of course, I switch sides. This is probably going to be more important to work on. I can feel this resistance. So I turn. You can do also muscle activation. You can use the band. You can use your arms. My favorite one, it's when people start resisting against your hand. So I'm going to show you on the right one what I mean, but I have to do this on the left side. So when you come in, you drop that shoulder down. You see my one arm, this one is drop it down, and I get this hand right by his head side. And what I'm doing here, I'm asking to push against my arm. No, against my arm, you by your head. So he's trying to rotate it. So you try to go the side bending.
With my head.
With your head, yeah. With your head. And what he's doing, he push against me. What he's doing, he's activate this muscle. And relax. Now I want you not just to push side bending, to try to rotate. So try to rotate your head to this arm. Yes. That shoulder, I'm just drop it down. Try to rotate. So basically I'll rotate against my hand. Here we go. Now it's probably better. Try rotate, and let it go. Now again, side bend, try to push against my arm. And I'm just doing this kind of relaxing. And let's do right side. So left side, sorry. So exactly, you see I push that shoulder down. I'm using my body weight. It's right there. And he push against me to the left. And if any pain present, he's going to tell you right away. Feel okay? Good. Push, keep pushing, keep pushing. You can do the ball. I can do ball against the wall. Some people lay down on the bed and push against the ball. Yeah, you just activate your muscle. And all you do, start rotate it. Try rotate to the left,
Right.
Yeah, you start rotating. And this is what I'm doing here. You see that clavicle, oof. Try to relax. Next one, I found that clavicle bone. This is the tuning fork. I come up here, and you see I grab that neck. I'm not choking, I'm not putting the neck. And all I do, I kind of very gently get this together. So this is my motion. I know the chiropractor, they do very powerful force. All you need to do, just very nice springing. Doing okay?
Yeah.
Relax, let it go. He's try to control that head. So yeah, and let it go. Switch side. I'm going to show you from this one. So you rotate first. Find that the big thumb is coming under the C7 T1. That where's that hump is start, and you start doing this. So what I'm doing here, yes, very gently. Here we go. You feel that click? Mm-hmm. Something click in his clavicle. So we shifted. Definitely we did something good. We'll see if he's turned. And let it go. Again, decompression, spine decompression. Ask him to turn again. Very slowly. See if this is, yes. I come back and work on that laminum groove again. So what I'm doing here, I'm gliding my fingers. See, I rotate the head, a little bit side bend, and get that big thumb right in that lamina. And I'm just gliding down, and if I feel there's something on my way, which is vertebra, could be twist, which is usually happen, I'm just work on it. And gliding down and up. So this is what I'm doing here. Okay, I'm already show you this way, rotate, side bend, lamina is up here, and all I do this way. You see, I'm going down, all the way down, and start from the top. I'm not pushing right in the behind my occipital area because we know this artery up there and nerve, occipital nerve, so we don't want that. We don't want push on that. If you want to work a little bit on the side, is work on the side. Also great exercise, great position for work on TMJ. And this is about it. Like I said, neck, I usually do 15 minutes max and do give them the homework exercise so they can truly work at home and understand why you need to make sure this neck is rotated. All right, let's do the shoulder. Okay, muscle up is not here. That's fine. And as a physiotherapy, a physio massage, we don't use a lot of oil. We don't spread on people a gallon of oil. So the pecs muscle could be really restricted, and you can see the shoulder is very high. So what I'm doing here, I'm get that pecs muscle just open up. I'm not pushing too hard, and I'm gliding down very gently. I can apply, you see my hand is straight. I'm apply pressure down, and it just kind of make him a little bit move. And after, I'm gonna truly dig in there. For the woman, the same. If the woman just try to get that breast down with the sheets, apply under the scapula. And this is the grip. So this is the forearm. The forearm fascia, you see, because my forearm fascia is really good grappling. So you see, I'm scoop, and I can move the whole body. You see his head is moving. Everything is moving. So I grab that fascia and I start dragging medial to lateral, away from the body. And what he's doing here, we already showed this many times. He started rotate this arm, shoulder in and out. Yes, make that muscle work. I'm truly to show you have to work on that right shoulder, but the problem is here. Rotate it. I'm gonna get up there. And let it go. So, yeah, let me just work a little bit on that one, and I will start live streaming on TikTok, and we can, guys, do that shoulder for you, for the camera. So that's about it. You see, I'm truly mobilized it. I can come up here, move. I give this motion. I can move him, that shoulder, and he can rotate by himself. Exactly. Rotate. This is the beauty of the manual therapy. Okay? Let me get that wrist. All right, so this is showing to you how to work on the pecs and mobilize that shoulder. You can see the shoulder is very high from the table. And what I'm doing here, I'm trying to move. We already checked the mobility and we have some limitation. So the first one, I'm not doing a lot of oil. You can see don't have much oil. So what I'm doing here, I'm just gonna work on that pecs. And this is what I'm doing. Just lean and kind of gliding up. And you can see rotate that shoulder. Just a couple times, just make that customer relax, understand what I'm doing here. If this is the woman, I usually put the towel, tuck that in so they open that upper portion of the pecs muscle. And the next one, I use my fascia on my forearm. So this is the area. I'm not using my elbow. People use that elbow a lot. So you see what I'm doing here, I grab that whole body, his fascia. He's always going to be tight up here, trust me, for everyone. Mm-hmm. You see how he's moving, his head is moving? So what I'm doing here, I grab that fascia and I'm gliding medial to lateral and ask him to start rotate this elbow in and out. If person can, you try to start helping him out. You see I'm grabbing and I pull. So, and this is the slow, very slow motion, but I show this for video purpose, so I do it fast, but usually it's take it slowly down. I mean, I wait double time. And yeah, you see he's starting not doing that. I ask him like, hey, drive the car, just imagine like riding or do computer work. So everything he's do everyday routine, I ask him to do. If uncomfortable for you, you can just come in up here, grab that pecs muscle, go ahead, drive your car, reach up, bring something, I don't know, push the weights. And you see, I'm just holding that muscle. There we go. And when he's doing it, I'm start mobilize it very gently. Do I push hard? No. Come back again, open this up. You see what I'm doing here? I'm rotate this elbow and wrist out. Also, that glenohumeral joint is start rotating, and I'm show you what I'm doing next. Next one, I can grab behind it. I'm doing better this way. Come up here on the scapula and above and start moving. He can also move with me. See what I'm doing? I lift it up, I'm straight. Get this arm on the side. Mm-hmm. So what I'm doing here, I lift. You see I'm lift, my arm is straight, and this one is help me out. And I'm just rotating and open more and more. Next one, we want to work on that glenohumeral joints right in that socket. And the best way, it's hard for me to do this on the camera, so I usually stay up here so you're not going to see it anything. But what we're doing here, we grab that humeral bone, I grab this under the triceps, get this in the 90 degrees, if a little bit less, if person can do it, and watch. What I'm doing here, I stuck this glenohumeral joint inside that socket. It's right there. You see, it's holding. And all I'm doing, I'm start moving around. But like I said, for the camera purpose, let me see if I can do this way. So you can truly see that motion. Here we go, yes. So you see my arm is under my armpit and I hold it and I control it. Now I'm sticking it in and I'm doing this. In all different directions. If any pain, always communicate if any pain. Stick in, rotate. Some people have experienced pain, so stop doing that. Send them to the doctor. They might have more issues. Come back. Working on those delts too. I like them gliding up and down. You can feel it. Also work on the biceps. There we go. Feel this one. Feel that? You feel it? Yeah, it's a little bit tight. So I ask him to do any actions, move. I'm holding it, so I cover it. Do some external, internal rotation. Yeah, so this is external rotation, this is internal rotation. You can bring in all different position. You see the wrist is coming this way. I can bring it here. You can rotate. I see a lot of people like to grab that elbow and kind of, here we go. Moving around, feel a little click. No force, no force. And of course, open this up. Let me show you the both side at the same time. My allergy is kicking in. Well, what we're doing here, the cross, I like that X. I placed one hand on that, and look at the difference already between the distance. It's already slowed down because we released that pec muscle. So I grabbed that pec muscle, cross, and I push that shoulder down. You see, I'm very in my body. I use my body weight on it, and I ask him just breathe. And start push your shoulder inside. Try to push your shoulder inside and let it go, relax. Again, push your shoulder in and relax. And he's always try to relax. Keep doing this one more time. Shrug and relax. And open this up. Okay, so this was the neck and shoulder, but of course we can flip him up, working on those subscapular muscle, rhomboids muscle. Let's see how he's gonna feel after this one. What else we can do? Yeah, so we probably should be good right now. Let him dress and reassess it. Thanks for watching, you guys. If you need more help, give us leave the comments below. We send you that link to our Patreon channel where you can watch those videos full length. It's just bad.
Losing interest or something.
No interest, exactly. It's just so bad.
It's not going to happen by magic.
Exactly. All right, so we just did let's say halfway treatments because we don't have much time, but we spent half hour on our neck and shoulder. So go ahead, try to turn a little bit more. Try to turn to the left now. Is that pain?
No.
It's still limited, I can tell, but it's no pain anymore. And he's doing much better. Go ahead to the right. Oh wow, the right is very improved. We probably work on more on the right. Can you take a look up and see what's going on up? It's getting a little bit improved. What about the flexion? Yeah, and flexion is better too. So we get some little bit better. And this, guess what? It just wasn't a half hour. We improved that guy. We want to truly work on that shoulder and of course thoracic mobility. We have to work on the thoracic spine. We didn't do this time. We did in a previous video. So if we put this all together, it's definitely going to improve. So what we learned today, every time you do massage before therapy, you have to assess the person. You have to understand where is the issue with the person. And if you don't know, we have a nice class which called Assessment from LifeRx Wellness. And we teach you guys in 8 hours how to become professional assessment guy in functional movements. This is all you need. And treat it. So we assess it, we treat it, we reassess it. It's better, it's better. Clients happy or not happy?
Oh, very happy.
Very happy. So if your client happy, he always going to book you, rebook you, and stay with you. Next one, we're going to work on this thoracic area. He's going to be more happy and more and more and more. And guess what? When you come in one day, he's going to turn without any problems. He's going to reach. He's going to do everything he's supposed to do, and he's going to be happy. And all you're going to do is just maintain him. And it's how beautiful just maintain people. You know how many people come in, they have a shoulder problem, you fix the shoulder, not to say you treat the shoulder, like 10 sessions, work hard, person disappear for a couple years, he think it's great, he's come back, and again, same problem. Because he never do the maintenance. You need to do maintenance. And this is how it is. Maintain your body, find a great therapist. If you guys are in life or Los Angeles, if you need treatment, give us a call. If you want to learn about massage, it's also a great class for you because we teach technique, assessment, and self and business growth. Okay? You guys have a wonderful day.